Welcome to our deep dive into the fascinating world of balance and its clinical assessment. Balance, or postural stability, is the dynamic process by which our bodies maintain equilibrium, whether at rest or in motion. This ability is essential for daily activities, sports, and even simple movements like standing or walking. In this video, we'll explore what balance truly means, the systems that contribute to it, and why its assessment is crucial in clinical practice. By the end, you'll have a clear understanding of how balance is maintained, what can go wrong, and how professionals evaluate and address balance issues. Let's begin our journey by defining the core concepts of balance and equilibrium. Truly grasp balance, we need to understand three key terms: center of mass COM, center of gravity COG, and base of support BOS. The COM is the point where the body's mass is evenly distributed, while the COG is where gravity acts on the body. For humans, the COG is typically near the second sacral vertebra, but it shifts with movement and posture. The BOS refers to the area beneath the body that supports it, such as your feet when standing. Maintaining the COM over the BOS is essential for stability. A wider BOS increases stability, while a narrow one makes balance more challenging. These concepts form the foundation for assessing and improving balance. Limits of stability refer to the boundaries within which a person can maintain equilibrium without changing their base of support. These limits are not fixed. They change depending on the task, the individual's biomechanics, and environmental factors. For example, adults can sway about 12 degrees forward and backward, and about 16 degrees side to side when standing with feet 4 inches apart. Sitting increases stability due to a lower COM and larger BOS. Understanding these limits helps clinicians identify balance deficits and tailor interventions to improve postural control. Balance is the result of a complex interplay between sensory, central nervous system, and motor components. Sensory input comes from vision, the vestibular system, and somatosensory receptors. The brain integrates these signals, forming action plans to maintain or restore balance. Motor systems then execute coordinated muscle responses. When any part of this system is impaired, balance can be affected. Clinical assessment must therefore consider each component to accurately diagnose and treat balance disorders. Next, we'll break down the sensory systems involved in balance. Three main sensory systems contribute to balance: vision, somatosensory, and vestibular. The visual system helps us perceive movement and orientation in space, using both focal and ambient vision. The somatosensory system provides information about body position and movement through receptors in muscles, joints, and skin. The vestibular system, located in the inner ear, detects head movement and position relative to gravity. The brain flexibly integrates these inputs, giving more weight to one system if another is impaired. For example, if somatosensory input is reduced, vision becomes more important for balance. Balance is challenged, our bodies use specific motor strategies to maintain stability. The ankle strategy is used for small, slow perturbations, relying on muscles around the ankle. The hip strategy comes into play for larger, faster disturbances, or when standing on an unstable surface, involving hip and trunk muscles. If these strategies are insufficient, the stepping strategy is used, where a quick step or hop realigns the base of support under the center of mass. Understanding these strategies helps clinicians assess which responses may be impaired and guide rehabilitation. Assessing balance clinically involves a combination of patient history, observation, and standardized tests. Clinicians gather information about the patient's age, medical history, functional status, and medications. Prerequisites for assessment include checking sensory integrity, muscle strength, coordination, and mental state. The main objectives are to identify disabilities, measure their severity, and determine appropriate interventions. Functional scales and specific balance tests are used to quantify balance performance and risk of falls. Let's look at some of the most commonly used clinical balance tests. Several standardized tests are used to assess balance. The Romberg test evaluates proprioception by having the patient stand with eyes open and closed. The one-legged stance test measures how long a person can stand on one leg. The functional reach test assesses how far a person can reach forward without losing balance. The Berg balance scale is a comprehensive 14-item test for older adults, while the timed up and go test measures the time taken to stand, walk, and sit. Each test provides valuable insights into different aspects of balance and helps guide treatment decisions. Beyond basic tests, clinicians use specialized scales for specific populations and conditions. The Tiny test, dynamic gait index, and functional gait assessment evaluate balance and gait, especially in older adults and those with neurological disorders. The Fugl-Mayer assessment is designed for stroke patients, while the BEST test and Mini-BES test provide a comprehensive analysis of balance systems. Dual task tests assess how cognitive demands affect balance. These tools help clinicians tailor interventions and track progress, ensuring patients receive the most effective care. Summary: balance is a complex, multi-system function essential for safe and independent living. Clinical assessment of balance involves understanding the underlying physiology, using standardized tests, and applying functional scales to identify deficits and guide interventions. Whether for older adults, stroke survivors, or those with Parkinson's disease, these assessments are vital for preventing falls and improving quality of life. By mastering balance assessment, clinicians can make informed decisions and help patients regain confidence and mobility. Thank you for joining us on this journey into the clinical assessment of balance.